Please don't be confused by my opening statements that I'm in the wrong chambers. According to data released by the CDC,
And please do state your name.
Justin Deal, licensed alcohol and drug counselor in the
Thank
state
you.
of Minnesota. According to data released by the CDC, more than 1,100 Minnesotans died due to excessive drinking in 2021. This number is a record high for the state, representing a doubling of the mortality rate since 2014. Last year, more Minnesotans died of alcohol-induced causes than to homicide and suicide combined. These numbers notably do not include what the CDC considers indirect lethal consequences of alcohol abuse, like drunk driving, homicide, and other actions. This is by a substance that has been legal, again, for the last 90 years. However, one category of the so-called deaths of despair is increasing even more rapidly in Minnesota. Last year, 1,498 Minnesotans died due to drug overdose. I do not know a single solitary individual who met criteria for substance use disorder in any of the categories of cocaine, opiate, or hallucinogen that didn't report to first using marijuana, and I know thousands. With respect to how short a time we get to speak, I will just deeply implore you all to read our own Minnesota Department of Health findings in a brief review of human studies regarding increased risk of harm with cannabis use, dated October 3rd, 2022. The Minnesota Psychiatric Society also released a study included in their report, and certainly worth mentioning in today's chambers. One, despite early reports, cannabis use does not reduce prescribed or illicit opioid use or overdose use fatalities. Two, a greater dependence on tax-supported public welfare, unemployment, and drug treatment services. And three, increased prevalence of highway fatalities due to marijuana-impaired drivers after enactment of marijuana legalization. Our governor was initially on the record at the beginning of the pandemic that he was going to shut down liquor stores as non-essential. As an alcohol and drug counselor, I called and left a voice message with him, and I wanted a drastic mistake that he was about to make, and how many thousands of Minnesotans that would have sent into alcohol withdrawal. If you do not think that an individual experiences both psychological and physical withdrawal from marijuana, you are greatly mistaken.
Thank you.